Welcome to the Ortho Joe Show, a joint production of the Journal of Bone and Joint Surgery and Ortho Evidence. In our world, orthopedic research is king, and current topics from our respective publications are analyzed weekly. Here is Mohit Bhandari from Ortho Evidence and Mark Swinkowski from the Journal of Bone and Joint Surgery.
Well, good morning, Mo.
Morning.
As you can tell from my artificial Zoom background, I'm in the office in Needham, Massachusetts, the office of the JBJS. And for you, I know you travel so much that you've got a tail of woe. And I know there are many listeners who listen to Ortho Joe that have had a summertime tail of woe. So my venture yesterday to get to here in Boston, flight leaves 3.5 hours late. We get into, I'm supposed to be here at 7, get in, 11. And then I get to the car rental place and there's a line that's 30 people long because they don't have any cars, right? So that's another 1.5 hours. And then I get on 93 South and they got it down to 1 lane. So this is near midnight and it's stop and go traffic to get to this. So I got in about 1 a.m. when I was supposed to be there at 7:30. So I have my Ortho Joe mug filled to the brim with my 4th cup, trying to stay awake. But I'm glad to talk to you because I know what we talk about is always so stimulating that I probably don't need the Joe. But anyway.
Well, I will tell you something. There's a viral clip, since we're talking about delays. Air Canada's, I think one of their executives was at the airport at Toronto Pearson and going on and on about how Air Canada, and I shouldn't be naming it airlines, but Canadian airline. Okay, just take it, forget everything.
A Canadian airline.
A major Canadian airline. Exactly, getting up and saying we made a ton of effort, a ton of investment into, making sure we can get our flights on time. And as they're doing it, the reporter slowly pans up to the board behind her. 7 Air Canada flights, delayed, canceled, delayed. It has become viral. It's viral. Everyone's just thinking, okay, how can you be, this is bad timing. But anyways,
yeah. I start with a topic we can all relate to, but I really want to, you are a master of the use of the LinkedIn tool, and I commend you because you've done a lot of work about balancing lifestyle and keeping the listening and watching public up to your pursuits and rapid downhill bicycling and climbing mountains and climbing sheer rock faces and your efforts to spend time contemplating. But you had a post, I think it was about 10-14 days ago, on advisory boards and what a waste they are.
I'll caveat by saying I've experienced many a waste of advisory boards, but sometimes you hit the sweet spot, and I was talking about what that sweet spot looked like.
Well, why don't you tell our audience a little bit more? I know there are people that listen into this that have experience with advisory boards, and I think what you were trying to bring up carries over to a lot of different organizational structures. But what was the main point?
Sure. On the broadest of discussions, it's really any team meeting, any major group meeting. But in this particular case, it was an advisory board group, a group of, and I'll use the word so-called because I always consider myself a so-called expert when I'm invited. So we're all these individuals invited with the purpose to discuss a particular problem or answer some questions. But I guess over the years, I felt that they're usually not productive use of time. And then when you make the effort to go and you get there, you realize this is just, I came out of it with very little, whether it's a team meeting, a hospital board meeting, a university, whatever it may be. In this case, it was an industry-driven board meeting. Regardless, what I did learn, though, is when things go well, Mark, it is uniquely different. So I'm thinking, why am I feeling good about this? Because normally I never feel good leaving a board meeting. I just haven't really felt like I've accomplished anything when it comes to these sorts of things. And I sort of reflected on what, sort of the things were, and in the post specifically, but, I use this acronym, which it helps you remember so that I don't have to, make notes. I remember it. I try to really think about what we were trying to do. And as a board, I felt we were trying to help. And then from that, those 4 letters are the things in my mind that remind me what we should be doing or what I should be doing when I'm thinking about participating. Well, one is leading with honesty, and we can speak to what that means, but not a lot of virtue signaling or posturing, just be truly honest. If you don't know something, or if something isn't working, say it. Like we're not there to be telling everyone how great we are. We're there to try to sort out a problem, let's hope. Um, Talk with evidence. There's a lot of opining about all kinds of things, but it's never driven in data. And when data is brought up, it's silent. I'm not saying this happens all the time, but in the worst case scenario, it happens. So begin with evidence.
Mm.
I think there's a lot can happen when we genuinely try to learn from each other. And actually learning means you have to listen to other
Yeah.
people. So, just sitting there quietly. And I'll tell you, as a sidebar, someone who did this very, very well, and I've been in a few meetings with, Professor Tom Einhorn, a good friend of yours and certainly a respected mentor of mine. I would watch him at a meeting and he would be quiet. And I say, oh, I guess he's just not interested in this. He wasn't. He was listening before speaking. And then he would say something at about 15 minutes in that would so clearly articulate the issue. And it started making me think, you have this anxiety to be the first to speak, but I think listening is a really powerful tool that he used very well. As an example, I remember that very clearly. And then the last part of it, P, was purpose. And why are we there? Half the time I leave wondering, like, why were we even invited to this? What was the purpose of this short of, meeting friends, colleagues, and then having a lunch and then leaving sort of thing? So really getting a sense of the core purpose. So those four things: honesty, evidence, learning, listening, purpose, and some sort of code of professionalism, which is we don't attack individuals, we attack ideas. That's totally fine. But if we don't attack ideas, we're not being honest. And that became this kind of sweet spot that I experienced. And I thought to myself, why am I feeling this as an unusual experience? And why can't this be the norm? And it seemed to, Mark, as you said, get a lot of interaction. I think a lot of people feel that there needs to be some changes.
Yeah, absolutely. And you're a chair of a surgery department, and you have regular meetings. And my sense is that the same acronym applies to a departmental meeting, particularly when you're the leader of that meeting. You agree with that, I'm sure.
100%. I honestly, I think walking into any meeting, we have to be, we can name the meeting as a board, but really it's a group of individuals coming together as a collective, hopefully to be stronger than the individual and trying to figure that out, right? And that dynamic. And I suspect to our listeners, at whatever stage or whatever level you're in, you're experiencing some sense of frustration or some sense of optimism, depending on the meeting you attend. And the question is, how do you maintain it, or what do you learn from the good ones, and what do you really learn from the bad ones?
Right. I suspect, you'll tell me if you disagree, but the P for the purpose, that really speaks against routine meetings, regular meetings that are just on somebody's calendar because that's what you do. What are your thoughts about scheduled meetings? What do you do at MAC in the surgery department?
Yeah, right. So the challenge I have, and I don't know if you've experienced this and others have too, which is someone will say, oh, can we meet, regularly? I say, sure, we should meet regularly if there's a purpose to meet. And then I'll leave. And I think it's been misheard as I'm going to insert a calendar invite every week, 9 a.m. on Tuesday or something. Not Tuesday, let's say Wednesday, whatever, pick a day, right? Tuesday, I love these Tuesdays. So, on those events. And I'm looking, and then you get there and you cancel them. You're canceling half of them. And now it's in your calendar. So I can't be the only one who's experiencing that. And so when you look at my calendar, I actually do every week on a Sunday, look at my week and say, what really has to be done? And I have no qualms anymore about rescheduling meetings or asking, why are we meeting? And usually when you say, why are we meeting? It's usually, oh, you're right. And then it's just removed. But most of us sometimes just go through, like I did it passively. So it's a meeting I'll attend and doesn't lead to much. And you realize you've lost big chunks of your day that you could have done other things that could have been, helping the mission and purpose of the institution or your, or your own personal programs. So
Right.
I will tell you also, like I looked at in preparation for this, because I thought, there's got to be lots of information. And there's lots of information, Mark, on boards and executive boards. But there was an interesting piece that I think by the Harvard Business Review in 2002 by Jeffrey Sonnenfeld, which talks about what makes great boards great. Now, I took away from it, not just it has to be like a fancy board of a group, but it could simply just be any group gathering, right? Any group that's meeting together regularly. And the first thing they said is, we sometimes create a group of people that we want. Let's say it's for a large trial, right? We have our steering committee that would be, in some ways, we're trying to get very prominent individuals. But they said regular meeting attendance is critical. So they talk about the reality is that you have to, if you're a director of a board or you're involved, you have to attend, you have to participate, and
Right.
being name only isn't enough, right? So they go on about how a lot of big companies will get very prominent individuals, but they never show up. So that was a big issue of it. You got to get people to show up. The other thing they said, which is interesting, is some of the strongest companies in history, GE back in 2000s was considered the greatest company ever. And they had given very little stake to the board members. In other words, like they didn't have a big stake in the company, which they actually felt was a positive because they were really genuinely interested in the company's growth, rather than, some companies that give massive equity stakes and massive incomes to board members. So that, you can imagine that, right? How that would have an impact. They talked about obviously skills. They talked about board member age, which is interesting, right? Because we're seeing a culture now where we're seeing a big shift to entrepreneurialism being the game of the 20-year-old. And I hear it all the time. I heard it at McMaster all the time that, young entrepreneurs are the future and the rest of us are kind of going to just, kind of hang on, right? And try to work with them. Interestingly, though, when you look at historical boards, age is actually considered an asset, not a detriment. And in fact, they talk about that board data from company after company says, you need to have some senior members of a board to give that culture. The other thing they also say is past CEOs. What happens, when there's a past chair, past CEO, past, editor-in-chief, whatever that may be, Mark, in someone's life, there's huge value to that individual still participating if they so wish to give that sort of counsel and guidance, which they talk about specifically on boards too. CEOs that are retired should still participate because they offer a lot of opportunities that people just lose when they just, don't engage them in a meaningful way. Independence, and the last thing I'll say to you is a culture of open dissent, which gets back to that whole issue of honesty, which so it's kind of nice to see that, right? You've got to be able to openly speak your mind and not feel that you're everyone's towing the same line, because then it's just a bunch of head nodding that's not going to lead to anything important. I found that important. I'm sure we could probably put a link to that. It was open access, so there's not a cost accessing it. So I suspect anyone who wants to read it could read it.
That's great. I certainly agree with the recommendation about having senior members. I've used my two predecessors, Vern Tolo and Jim Heckman. They remain on the editorial board and are invaluable in offering wise counsel when it comes particularly to complicated interactions with authors and with other boards, etc. That transitions into a topic that came out in this bi-weekly publication of the journal. Was an excellent What's Important article by my friend and colleague Joe Zuckerman, the chair at NYU, on the Aging Orthopaedic Surgeon. And he does an excellent job about outlining the issues in terms of surgical skill and judgment and how one can continue to contribute. And I'm sure you've already come across some of that in your term as chair of surgery, how to deal with it. I certainly am at the end of my career, and the way I've dealt with the issue about fading skills is I have these wonderful scrub techs and circulating nurses, and they have all been commissioned to tell me exactly if they ever see a slip in skill or judgment or hesitation or something inappropriate. And I've offered to reward them financially if they ever see anything like that. But what are your thoughts about the whole issue about the aging surgeon?
Yeah, I mean, and you start thinking about it more and more with every passing year. And, you always think there's this cognitive dissonance, which I have time. But the reality is, if we don't plan for things.
Well, you do, but I don't.
Oh, no, listen, we all have time. You have lots of time too. Trust me. So, but in our institution, there's been, and I think there's been, and we've been seeing that same things happening across Ontario. I think Sunnybrook has done the same with the University of Toronto and University of Western Ontario. Western University is doing the same thing, which is they're finding these opportunities for, well, you've used the term aging surgeons, but I'll say the more, experienced, seasoned, surgeons who are now looking to transition to a new part of their life. Mentoring, so like almost having a paired practice. So as someone goes from 100% to 80 to 50 to 40, there's a ramp up of a mentee surgeon that will ultimately take his or her position, which I think has worked out really well. It's a little tricky, in making sure that there's, a real alignment of of ideas, but when it works, it is such a amazing experience that you'd wish you could make it happen for everyone. It doesn't always happen, and not everyone is amenable and wants to have that happen. But that's been one model that we have seen at least tried and raised with many of our senior surgeons. And I say on half at least have really endorsed that idea, and others just are still trying to struggle with the idea of slowing down, which is really hard. I mean, that's the other part of it, right? Is what do we do when we're no longer an orthopedic surgeon? What do you actually do? And when I ask, at our annual meetings, hey, I always ask, are you happy? That leads to a whole wormhole for some people. Like, like, what do you mean happy, right? So you go into that, but after you get past that, it's like, well, if you weren't working in orthopedics, what would you do? How would you spend your day? And surprisingly, there's not a few individuals that really haven't considered it. And I think it's important to have those discussions.
Yeah, absolutely. And pay attention to balance in your life. And that's what you've been so great at with sharing your experiences and interests on LinkedIn. And I think it's a real contribution to not only the field of orthopedics, but also professionals everywhere. So kudos to you. So with that, I'm starting to fade due to my lack of sleep. And I got to go get the 5th cup as I have a couple of meetings here at the editorial offices. So Mo, great to talk to you as always. Cheers. And
cheers to you. And may your return flight be far less than several hours. Let's just it's quicker. Let's just hope it's quicker.
I'm praying for that. But have a good day, Mo.
You too. Take care.
Okay. Bye.
Bye-bye.